My name is Sidney Marchasin. I'm a primary care physician. I've practiced in the Redwood City, San Carlos, Belmont area for approximately 51 years, and I have taken a short break, and I'm going to be reopening an office in the next couple of months in Redwood City. The reason that I'm here is to talk about Obamacare, legislation which has a very negative impact on the overall quality of care. The legislation has been in effect in approximately 1 year, and I will discuss some of the problems. The goal of Obamacare was to provide universal health coverage and high-quality care to all citizens. The reality is it authorizes an expansion of government authority over doctors and hospitals. Government officials can tell doctors and hospitals what is quality, what is not. Obamacare, in reality, is a disaster. And it's going to increase government spending and the deficit and provide a lower quality of care to people who are in need of medical attention. Now, we're already seeing some of the problems from the enactment of this law. There were 60 new hospitals that were planned by doctors that they have now canceled, knowing what they are going to be faced with, and that hospitals may become a source of loss of money, and the ability to take care of the patient in the way that these doctors wanted to is being hampered. There are lots of newer technologies that are coming along: MRIs, fancy X-ray pictures, CT scans. These tests are expensive, but they will often help us determine things that we cannot by routine tests. And there are newer technological advances occurring, but now a lot of the individuals involved in these newer technological advances may decide to walk away because of the law that says, we can't pay for this. This is the amount we're attributing to each patient. And in this country, I think we want the best quality care. We want the new advances. We do not want a government bureaucracy telling us how we should manage the patients. Now, we are not there to distort the economy, make it difficult for the government. Our goal is to provide quality health care, give to the patients what they need and what they agree to, and we do not want to be told by a bureaucratic government what they think is in the best interest, when it often conflicts with what we think and know is in the best interest of good health care. We as physicians do not make money on tests that we order in the hospital. The hospital owns the machinery, it owns the equipment. Our interest is in doing what's appropriate for the patient, and artificial caps put on the amount of money that can be spent is a detriment to health care. The doctor, the patient should be able to decide together as what is appropriate, and we should have the ability to do what we think is necessary for the patient's best care. Now, I am not unique in my feelings, and I would like to quote from another individual, Peter Ferrara, F-E-R-R-A-R-A, who has also studied and written about the Obama Act. And again, his stipulation is that in writing is Obama's plan is a disaster. Rather than liberate the American healthcare system from bureaucracy, it wastes blankets with more suffocating innovation, destroying freedom. It's inconsistent with prosperity, living standards, and traditions of the American people. And in the majority of individuals that I have talked with over the months that this policy has been in effect, all the practicing physicians have felt that this is an improper law and is detrimental to the overall quality of medical care in this country, and it should be repealed. We want to do what we think is appropriate for the patient. We don't want to have to think that certain tests are expensive if they may help the patient recover or improve faster. And as I say, when we take care of people in the hospital, we do not own the machinery. We do not own we do not make a profit out of anything that we order. We're interested in quality care, getting the person well, and that's what this is all about.